Ready? Hello, everybody. I am Dr. Polak from Progressive Pediatrics in Union City in Dale, New Jersey. I've been practicing pediatrics since 1996, and I'm here to talk to you today along with Dr. Teraguchi about testing in our community and in our practice. Dr. T?
Hi, this is Dr. Teraguchi. I've been practicing pediatrics since 1998, and I've been with the practice for 11 years. Hello.
Very awesome. So let's get to it. So Progressive Pediatrics is now doing testing on children in our office. The type of testing we're doing is the nasal swab. So it is not the one that is nasopharyngeal, so it doesn't go all the way up your child's nose, but it is an anterior nasal swab. So it's a cotton swab that we put to the front part of the nose here, and it needs to be twirled around 3 times in each nostril. And then we put it in a small container of solution that must be frozen, and we must submit it to a lab on ice. The lab picks it up. We get the results in 3 to 5 business days generally. And this test only indicates the current state. So if your child is currently infected with COVID, it does not tell us if they've been infected in the past, and it does not tell us anything else about their health condition. That's what we're doing in our practice. Dr. Teraguchi, would you please tell us who we're doing the testing on?
We are doing the testing on any of our patients who have fever, symptoms of a cold, or diarrhea or vomiting.
Or if they were exposed to someone.
Or they were exposed, yes.
Right. So I just want to make it clear that we cannot tell the difference between a common cold or a stomach virus and COVID just by examining your child. So if you come into our practice with those symptoms, even though the most likely diagnosis is a regular viral syndrome or a stomach virus, we cannot tell the difference by examination or history. And that's why we have been doing the testing on the children. So the other reason we've been doing the testing is for protection. We want to protect your child by keeping a close eye on them if they have a positive COVID test. We want to protect your family. If your child is positive for COVID, the rest of your family needs to quarantine. They need to know so they can watch for the right symptoms, and they probably need to be tested by your own doctors. And the other reason we're doing the testing in our office is because of our community. It is part of our responsibility at Progressive Pediatrics not to send a child back to school or daycare if they have COVID. And therefore, the only way to tell for sure, well, sort of for sure, because none of the tests are perfect, is by doing the testing if we suspect it. And we suspect it in those symptoms that Dr. Teraguchi discussed. So that's the bottom line. Dr. Teraguchi, would you please tell us where we're doing the testing in our office?
Okay, well, safety is our #1 priority. So we are doing testing in a room in which there are no well patients ever in that room. It's purely for testing. And the room is fully ventilated, and we have a large HEPA filter that cleans the air. And between each patient, we not only clean the air and ventilate the room, but we also thoroughly wipe down the room with antiviral disinfectant.
Excellent. So we want to make sure that you understand that if you come in with a well child, there's no way you're going to go into that room, and that we, physicians and other staff members, change our PPE between any sick and well patients, of course. So you cannot get it from us. Obviously, we're thoroughly protecting ourselves as well. We are wearing eyewear, we are wearing N95 masks, we are wearing gloves and gowns, we're wearing face shields, we're wearing lots of stuff, not only to protect us, but to protect you from getting anything as well. So that's really the bottom line with testing. So the message that Dr. Teraguchi and I want to give you is that we are here for you. If your child is having symptoms, we would like to take care of your children if they're well or if they're sick. If they're well, they're going to come into a thoroughly sanitized well room. If they're sick, they're going to go into a different room. And if we need to test them, we will test them. We also want to make it clear that our practice does not benefit in any way from doing testing. So we do not get paid by the labs to do a swab. We do not get paid by any insurance company to collect the swab. We are not reimbursed for any of the extra PPE we use to do the swab. So it is not for our benefit that we're doing this testing. It is simply to protect your children, your family and friends, and our community from further spread of COVID. So if you come to us for clearance to return to daycare or to return to school or work for parents, we want to help you understand that we're doing this testing for your well-being, and we cannot write you a school note to return to school unless we are confident, reasonably confident, that your child does not have COVID. And at this point in time, we cannot tell that by symptoms or history alone. Dr. Teriguchi, can you tell us what guidelines we're using to make these determinations?
Sure. So we're following the guidelines outlined by the CDC, the New Jersey Department of Health, and the American Academy of Pediatrics. And constantly, every day, we are always checking for updates and making sure that we are doing what's up to date and recommended at that time. And it's sometimes it's changing. So we are really making an effort to really stay on top of things so that we are offering you the best quality of care based on guidelines and science.
Awesome. Thank you, everybody. We want to let you know that we're there for you 7 days a week in Union City and 5 days a week in Bayonne. If you need us, please call us, and we will do our best to see your child as soon as possible. Have a great day and have a good weekend. Bye-bye.
Okay, bye.